It's a startling statistic, but approximately 700 American women die from pregnancy-related complications. Dr. Molly Long, an OB/GYN physician with Women's Care Florida, joins us to explain how providers are helping patients have healthy pregnancies. Welcome to the show, Dr. Long. How are you?
Good, thank you. Thank you for having me.
I think this is so important, and I'm not going to lie, it kind of caught everybody in our group a little bit off guard, because this is something you don't think about. You just take for granted. You're going to have a baby, you're going to move on, you worry about the baby. We need to kind of spread this message, it sounds like, right?
Yes, we definitely do, because it's really a big problem. And nationally, across the United States, we really have a high maternal death rate compared to almost every other country that has...
Wow. No, compared to every other country.
Yes.
Okay, with that said, obviously the question, and I'm sure not to glaze over it too much, but why is that?
Well, there are a lot of reasons for it, but I think a lot of it may have to do with access to health care and perhaps even transportation issues. I think, like you said, a lot of people just aren't really aware of how high the mortality rate is during pregnancy and in the immediate postpartum months. And women really need to try to do as best they can to help prevent these complications from occurring. They really need to be aware of some of the danger signs both during and after the pregnancy. And we also want them to make sure they deliver in an environment that's safe and that can get them quick access to emergency services if they're needed.
You know, I'm going to ask, what are some of those warning signs right now? What are things for people to keep in mind?
Well, during the pregnancy, you definitely want to make sure that you have any chronic medical conditions really under control. Okay. High blood pressure is a big problem. If you develop a headache during the pregnancy or after the pregnancy, especially within that first 1 to 2 weeks, that's just the worst headache you've ever had, or it's not going away with medication, you really need to call your healthcare provider or even go to the emergency room. After delivery, you want to really look for signs of infection, like fevers. If your bleeding is getting worse instead of better, or your pain is getting worse instead of better after delivery, you really need to also contact your healthcare provider.
You and I were chatting before too, and you were saying some of these complications are even months after delivery, which I probably wouldn't even think to chalk it up to the actual delivery itself.
Yes, so about a third of the deaths occurred during the pregnancy, about a third occurring during the delivery or within that first week after delivery, but a third occurred between 1 week and 1 year after delivery.
I wouldn't even attribute that. What are some of the complications that we are talking about? We talked about the warning signs, but what do you see?
So the number one actually cause for maternal mortality is a hemorrhagic stroke. Usually that occurs due to uncontrolled high blood pressure.
Okay.
So that's the number one reason. There's also postpartum bleeding or, a hemorrhage that can occur with or just after the delivery. And then the things that usually happen further out, a little more rare, but cardiac disease can be a major problem. And also infection, and sometimes even the high blood pressure can occur within a couple months after delivery.
I remember when I was pregnant, so much focus was on the doctors that you choose, where are you going to deliver? Like, it seems like a lot of focus is there. What can doctors and providers do to help this mortality rate, or what should we look for as patients when it comes to helping this?
Right, so you really want to make sure that you have good prenatal care. You want to make sure that you have a doctor that really gets any chronic medical conditions under control, and you also want to make sure that you're going to choose a delivery location that can provide these emergency services. Some birthing centers may be able to do that, but mostly it would be the hospitals. Mm-hmm. You want to make sure that they are equipped to handle any postpartum bleeding or emergencies quickly. A lot of the hospitals, I work at Bayfront Health, and a lot of the major hospitals are running drills, they're running codes. I know that they've gone to having hemorrhagic carts easily available at our hospital, and I think most other hospitals are doing this as well, where you can actually really get a good measurement of the blood loss so you can early intervene. They have the medications and some other devices available that can help control the bleeding, as well as blood products that can be immediately sent if you call a code. You want to make sure that obviously they have access to surgical interventions if they're needed, and sometimes even radiologists can be involved with treating the bleeding.
I'm so glad we talked about this. Again, it was one of those things when I saw it come across my desk, I was like, what? We're talking about what? But again, this is so important. Thank you, Dr. Long, for sharing your time and talking about this with us. If you have any questions about this or want to make sure that you are in the right hands and want to be able to find a provider that you are comfortable with, and Women's Care Florida is on your list, well, there's the website so you can get more information from them. Thank you again for joining us.
Thank you.